Up from last week's video about how the Emsella chair works, role in strengthening pelvic floor, and all the things incontinence related and what we can do to begin to improve that and how effective the chair is at that. Inside that conversation, so if you want to go back and listen to that one, that would probably be a good place to start. But to kind of piggyback off of that, we talked about the role of pelvic floor in postural health, spinal health, chiropractic, holding and adjustment, and there's a lot to kind of dig into around that. And so we talked about doing kind of a follow-up call or video on talking about how the pelvic floor and the core in general is super related to posture and spinal health and people's ability to hold an adjustment a lot of times. So as a refresher on what the Emsella is, in case you didn't hear the last video or don't want to go back to it, the Emsella is a pelvic chair that you sit on that uses high frequency electromagnetic impulses to get you to contract your pelvic floor unconsciously in a way that you can't normally do on your own. So they call it supramaximal contractions. So we kind of talked about that last time, but essentially if you were to try to do a Kegel on your own, you're getting maybe, if you're lucky, about 30% of a muscle contraction as you're trying to do that Kegel. The chair allows you to get a much higher contraction and to hold that contraction for a longer period than you can do by yourself. And so the equivalent of 28 minutes on the chair is like doing 11,000 Kegels, which would almost be impossible to do on your own in 28 minutes. Probably impossible for a lot of people to do in 28 days, let alone one session in 28 minutes, fully clothed, non-invasively. Tons of benefits and high points to using the Emsella chair for anyone who has, last week we talked about incontinence, but really any time you want to strengthen the pelvic floor and the relationship to that and core strength is huge.
And you don't necessarily have to have manifested symptoms of incontinence to actually benefit from the chair in this way. When we're talking we have a couple of floor to core like programs and things like that actually you don't need to have a problem with incontinence to derive all the benefits of using it in this way.
Yeah, and we have some people who use it preventatively. We have some people who use it, we kind of also talked about the sexual benefits of using the Emsella chair. But I think getting back to how pelvic floor is related to overall core health, there's a neurological component to what the chair is also able to do, and the fact that it's recruiting a larger percentage of your pelvic floor to contract together at the same time. And so you're helping to train your brain to engage those muscles together. And as you're getting that recruitment and your brain signaling and turning those muscles on, that also starts to engage and improve overall core engagement. Because most of any motion that we make, whether we're standing up or we're walking or we're bending over, all of those patterns of the way we move and our muscles should engage should honestly begin in the pelvic floor and in the core. And if they don't, then imbalances begin, then compensations begin, and then over time, much higher frequency of lower back injuries. And so, a lot of times in our paperwork, we'll try to ask people like, how would you rate your core strength? And really tough for people to kind of say, like, I don't know what my core strength is. But most of the time it's ranked low, right?
Yes, that's such a good point too, because usually if they're coming in and filling out paperwork, and like you said, there's already some kind of a compensation right there, that has a lot to say. That speaks volumes, right? Because I've heard you say, oh, you're using muscles that weren't intended to use in order to create this movement, which is really fascinating, actually. So that compensation, and then that overused muscle or, underutilized muscle on the other side, on the reciprocating side, but just knowing that you are imbalanced right there speaks a lot to where your core strength is, especially if you don't know how to gauge.
Yeah, and I think that's the point we want to drive. One of the big points I want to drive home is if your pelvic floor and your core is not strong, you are drastically at higher risk for lower back injuries.
Yes.
And that can come in a lot of different fashions. That can be something really significant, like you're going to load your lower back up a lot higher as you're lifting something, because you're not engaging your core and you're just using your back. And now we have a disc issue, which is probably one of the worst case scenarios that people can begin to have. I think next to that is, okay, let's say you're sitting poorly for years, you don't have a strong pelvic floor or core, you have bad posture, then you bend over and pick up a sock off the floor, and we've talked about this in the past, right? You injure your back. It wasn't the sock that did it. It was years of these other issues that have kind of built up over time, and now you have a lot of degeneration and arthritis in your lower back that you didn't know about. That is significantly harder to treat and work on, sometimes more so than somebody with a disc issue. And so all of this is set up by patterns. So kind of like what we were just talking about earlier, when you're not engaging the muscles of the pelvic floor and the core correctly, you just start to compensate. And oftentimes you begin to use larger muscle groups. And so, when we look at posture, there's really small muscle groups that kind of help us to stay erect throughout the day, but they're not necessarily designed to do a lot of heavy lifting. And then we have larger muscle groups that aren't great at stabilizing you or aren't meant to be used constantly all through the day, but they're really good at helping you when you need to lift something. The problem is when those stabilizers become really weak because we're not engaging them or strengthening them, then our major muscle groups start to take over, and oftentimes we're having the conversation of these muscles are doing a job they're not designed to do. Right? Your traps are not designed to constantly be over contracted, holding your head up, because you're looking down like this all day. You're looking down, or you have no curve in the neck, and now those muscles in your upper back and lower neck are just working harder than they should be.
Just to hold your head up.
Yeah, same thing happens in the lower back. A lot of times people will ask me, like, do I need to strengthen my lower back? And oftentimes the answer is no. We have big muscles in our lower back a lot of times. It's usually not a strength issue. It's usually those muscles are so tight, so contracted, because they're compensating for other muscles that aren't engaged, like your core and your pelvic floor would be number one. Number two would be like your glutes and hamstrings, right? A lot of times those are so tightly wound up that they're extremely weak. Or you can also say the opposite. They're really, really tight because they're weak, and again, they're not they're doing a lot of work that they're really not supposed to do. And so, that's one of our goals is when we're working with people is we want to address some of those imbalances and issues. It's really hard from our perspective in really understanding where someone is at with their core. I mean, obviously, if somebody is extremely overweight and obese, then that's pretty much a given that they don't have a lot of core strength or pelvic floor strength, because the risks for that go way up. But it's kind of the rest of the population that, if you're having incontinence, you definitely have a weak pelvic floor and probably core issues. But I would say anybody else who's chronic lower back, the other thing that we talk to people about is, if you're not holding your adjustment, then that's a really good sign that you've got a lot of core and pelvic floor issues. So,
and what do you see in, what are some indicators? How quickly, is that turnaround in being able to hold? What do you like to see as far as people holding their correction?
I think.
How would someone know they're not holding their corrections well?
Well, what I like to look at is, there's a lot of factors, but if somebody's coming in and we're really needing to do the same thing over and over and over and over again, then we're missing something.
Right.
So either there's another layer that we need to start adjusting and kind of look at how things are working differently. We need to look above or below that. Or a lot of times it's, you have muscle imbalances that are constantly making you more prone to misalignment and tugging and pulling that's creating too much stress on a joint. Obviously, we have to also look at, what someone's doing all day. So if someone's like a mechanic bent over a car all day, then or they're doing activities that are repetitive, then maintenance might look different for somebody.
Sure.
Right? And so sometimes maintenance is every 2 weeks, and sometimes maintenance is a couple times a year for people, depending on activity levels and lots of factors. But
and then structure too. Somebody with scoliosis is going to need a lot more maintenance for mobility's sake, just to keep.
And how long they've waited, right? So somebody with more advanced arthritis or degeneration, or you have a disc issue, there's just damage to tissues that we can take pressure off of, but the damage is still there and probably going to require a little bit more maintenance than somebody who doesn't have those problems or issues. But when we do look at somebody who's where you felt great after the adjustment, but a couple days later, a week later, 2 weeks later, it's the exact same problem again, then we need to take a look at what activities are you doing, and at that point, it really is, muscle imbalances, core strength, pelvic floor. What are we missing?
Right.
Or what is weak that you need to address inside that? Because we can, help identify that you have a weak pelvic floor or you need to work on core strength, but that's not something we can actually do for you, right? Like, we can tell you what to do.
Right.
And that's one of the beauties of the Emsella is
it can literally do it for you, right? It is a literally involuntary contraction that it is providing for you,
right?
Which is impossible to do on your own. Impossible.
Yep.
I shared that last time. We grow up, and we physical therapy, and they're after having babies, and you go through education on how to do Kegels, and you can have all the education in the world and still have no idea what you're doing, really. And I've had no idea what it actually feels like. to do an actual Kegel. So.
But now you do.
But now you do, exactly. Which is worth everything for that neurological component, because now my body has a memory, right? Now my body knows, oh, this is actually how to contract those muscles. And I could not have known that before on my own. Mm-hmm. So that's worth coming in and actually, right? That is all of that is actually worth just coming in and having a consultation for.
Right, yeah. Just sit on the chair for 10 minutes and feel what
that actually feels like.
This is what a Kegel feels like, and this is what this is what contracting my pelvic floor feels like.
Feels like, exactly.
Yeah, I agree.
Yes.
And I will tell you, because I'll do the Emsella chair. I did it for just to see what it was doing for people, and to see what benefits I got from it. And I can tell you the same thing. I don't typically have pelvic floor issues, and I don't typically have lower back issues, but I could feel a difference in my pelvic tilt, posture, how I was just engaging overall core just from my pelvic floor being stronger and more engaged as I'm sitting or moving. I stand all day and I bend over a lot. So if the tilt in my pelvis and I'm not engaging my core, I have a weak core, I'm gonna for sure have lower back tightness and stiffness and all kinds of other issues that start to creep up after a week of being on my feet working all week, and definitely notice a huge difference with the Emsella and being able to just engage that pelvic floor and take some pressure off of the lower back a lot more.
Yes.
So I would say if you have lower back issues, any kind of disc problems for sure, if you have some arthritis and degeneration in your lower back, or you just are not consistently holding your adjustment, especially in the lower back, then strengthening your core and your pelvic floor are super important. There's a lot of core exercises that are great. Honestly, what I recommend the most are probably planks, because if you have lower back issues, the bending and the twisting and the stress, a lot of the other forms of core strengthening will oftentimes put more stress on the lower back or some tightness. A lot of hip flexor issues will start to pop up. But planks, there's tons of variations. You can make them easier, harder. That's always my first place to start with people, and then you can go bananas with all kinds of core exercises. But until you get really good at holding a plank for a while, I would just stick with that. And if you're having incontinence or pelvic floor issues while you're trying to do a plank or core exercises, then you absolutely need to focus on doing strengthening your pelvic floor first. Obviously, we have an Emsella chair, so we are very pro this, but also in general, Kegels can be effective for some people. Pelvic floor therapy can be effective for some people. Just our experience has been, you don't know if you're doing it correctly. Right. You don't know if you're engaging the right muscles. Even if you are engaging the right muscles, you're only not even going to do half of what you could do with by sitting on the Emsella chair. And so for all those reasons, this is a fantastic way to improve your overall pelvic floor strength, your core strength, take stress off of your lower back, help you to stabilize and hold your adjustments a little bit better for the lower back. And then we see that start to creep into all types of other areas, right? When when you have good foundation in your pelvic floor, your core, and your lower back, now my posture in my neck and upper back feels a lot better. Now there's less tension on my knees and down into my legs. And so really is a foundation to a lot of other movements and patterns that we talked about. But if you don't have those, then you're going to be compensating and really leading yourself, setting yourself up for injuries and much, much bigger issues down the road.
Wow. So I know we talked about it last time, but is there anyone that this wouldn't be beneficial for?
Yeah, so...
Or not, or it's more of a contraindication.
Yeah, so
it would be beneficial, it's just that there's contraindication.
Right, yeah, so we can't do the pelvic, we can't do the Emsella with anyone who's got metal in their abdomen or hips. Also, if you have any kind of stents, pacemaker, anything electric or metal in your heart or lower back, we can't do that. Insulin, like insulin pumps or any kind of pumps.
Right.
We can't do that. Obviously, we can't if you're pregnant.
Right.
But other than that, it's pretty open to everyone who's having issues or problems.
That's great.
Yeah. So if you have questions on whether to know how you're doing on your core strength or pelvic floor strength, comment in the section. Comment below. We're happy to answer any questions about that. If you have any questions on the Emsella and the technology behind that, please let us know. And even if you want to stop in and just sit on the chair for 10 minutes, as long as you don't have any of the contraindications, so you can see what it feels like for your pelvic floor to be engaged and start to work on your core strength, certainly reach out. We're happy to set that up for you and walk you through that process. So otherwise, a little shorter talk today, but really just designed to kind of highlight again the importance of pelvic floor health and its relationship to not just incontinence and sexual health, but also keeping you able to do all the things that you want to be able to do for as long as you want to be able to do them.
That's right.
Yeah. So we'll see you all next week. Have an amazing week, and welcome to September, right?
To September.
Gosh.